Is your baby getting enough milk? A common concern of many new mothers is whether their baby is getting enough milk, especially since there is no way to measure the amount of breast milk a baby is drinking. Fortunately, there are signs that can ease your mind about how well she is feeding. This video will show signs to tell whether your baby is getting enough milk. The first sign is the passing of stools and urine, especially in the first few days. Colostrum, the early milk, acts as a laxative and helps your baby quickly pass meconium, the sticky black first stools. As your baby drinks more milk, her stools will become lighter. By the end of the first week or sooner, your baby should be passing loose yellow stools. If meconium is seen on day 4, this is a warning sign that your baby is not getting enough milk. How often your baby is urinating is also a helpful sign. In the week after birth, your baby should generally urinate 1 time for each day of life. Once on day 1, twice on day 2, 3 times on day 3. After the first week, she should be urinating at least 6 to 8 times a day. The second sign is whether your baby is drinking well. Seeing and even hearing your baby take good deep swallows will tell you your baby is feeding well. Watch the movement of this baby's jaw. When the baby is drinking well, there will be a pause and drop in his jaw as he swallows. Look closely. The baby is sucking and swallows. Suck, swallow, suck, swallow. This baby is not well attached. He's making short, quick, shallow sucks, then rests. His jaw does not drop low to show he's swallowing milk. He's only suckling, not swallowing at all. Babies who are only suckling at the breast soon get sleepy. You may think your baby is full, but she may simply have given up and will soon waken and need to feed again. Now, watch the deep rhythmical motions of this baby's jaw. Each suck this baby takes results in a swallow of milk. He is drinking very well. See the difference. This baby is taking only rapid shallow sucks and soon loses interest, compared to this baby who is drinking well and is very alert and awake. The third sign is your baby's activity level. A baby who is getting enough milk is alert and active when feeding, and feeds at least 10 times between one sunrise and the next. The baby will often drop off the breast at the end of a feed and be generally content between feeds. Some babies who aren't feeding well are very fussy and want to be on the breast constantly. Other babies act sleepy and satisfied. If your baby falls asleep within the first few minutes of breastfeeding, the flow of milk is probably slow. The young baby who has trouble being aroused may not be getting enough to eat. If your baby is not waking for at least 8 feedings a day by the end of the first week, this is a warning sign. Knowing the signs that tell you your baby is getting enough milk is one of the most important things you can learn as a new mother. Remember, the best early indicator that your baby is getting enough milk is the passage of urine and stools. Seeing the deep rhythmical drop of your baby's jaw shows you he's drinking well. A baby who is getting enough milk is alert and active while feeding.